Blood supply of uterus. Very important topic for graduates, postgraduates and practicing OBGYN. The common iliac artery divides into internal iliac artery and external iliac artery. The anterior division of the internal iliac artery is a uterine artery. It goes towards medially. It runs medially and about a 2 centimeter away it crosses the ureter before touching the uterus. At the level of cervico-uterine junction, it goes into the uterus, the uterine artery, and at that level, it divides, at this points, it divides into two branches, the ascending one and the descending one. The ascending branch, it runs very laterally to the uterus and it is very convoluted, and it divides at the level of fallopian tube. It divides into three branches. The first branch is ovarian branch of the ovarian artery and it runs towards the ovary, and the upper branch is the tubal branch of the uterine artery which is into the mesosalpinx of the tube, and the third branch is the fundal branch which goes into the uterus. The another supply of the uterus is ovarian artery. It comes directly from the aorta, and with the ovarian branch of the uterine artery, it anastomoses and supplies also, and at the level of hilum it goes into the ovary, and this anastomosis is also the uterine, and same another branch is for the fallopian tube and anastomosis with the tubal branch of the uterine artery, and fundal branch is the third branch which supplies the fundus of the uterus. The descending branch of the uterine artery, it supplies the cervix and the upper portion of the vagina. The another supply is from the internal iliac artery for the uterus is vaginal artery. It also directly comes from the anterior division of the internal iliac. This vaginal artery, it anastomoses with the descending branch of the uterine artery and supplies all the vagina. The uterine artery, there are few branches which directly go inside the uterus, and these are, it's a similar pattern on the other side of the uterus also. Now there is just a one cut section of the uterus to tell about the detail about the internal supply of the uterus, that is the serosa, myometrium and endometrium. There are branches. From the ascending branch, there is a one branch which goes very close to the serosa and attaches with the other side of the uterine artery. This is called the arcuate artery, which is very close to the serosa and into the myometrium. This is a arc shaped, that's why it is called as arcuate artery. And this arcuate artery, there are branches from the arcuate artery. They are right angle from that is called a radial artery. This radial artery goes into the myometrium, and they are arcuate arteries. In the cut section we can see they goes into the myometrium and goes through myometrium and go into the endometrium. These are the radial artery. Radial artery is very, very important. It has got two branches. One is the basal artery and another is the spiral artery. Basal artery is basically the straight one. It's a straight artery, short and does not respond to the hormones. And the another is the spiral artery. It's a long, very, very long. It's a convoluted going up to the into the endometrium, and it is respond to hormonal changes. So the spiral arteries are very, very important for any changes into the uterus, as well as it's important for the pregnancy. So this is the supply of uterus. Thank you so much.